Hi everyone, I'm Peter Chu, a urologist from the Chinese University of Hong Kong. Welcome again to the first Asian series of Grand Rounds in Urology. This is a series of talks by a group of Asian experts to talk about important urology topics from an Asian perspective. And today, we're honored to have Professor Hsiang Ying Lee here to give a talk on upper tract urothelial cancer, the unique Taiwan experience. Professor Hsiang Ying Lee graduated from Kaohsiung Medical University in Taiwan and is currently the assistant professor in the Department of Urology of the same university. She was the recipient of the UTUC International Academic Exchange Program Scholarship Award and the Taiwan Urological Oncology Association Award. Her research focuses on urological oncology and urothelial carcinoma and upper tract TCC in particular, and has published numerous papers in this field. Taiwan is well known for having one of the highest upper tract TCC incidence in the world, and we are honored to have Professor Lee to give us a lecture on upper tract urothelial carcinoma, the unique Taiwan experience. Thank you, Dr. Lee.
Thank you, Dr. Peter. It's really my honor to talk about our unique features of UTUC. I will introduce Taiwan experience about the UTUC. And as we know, UC is the most common malignancy of the urinary system from urothelium and divided into upper and lower tract UCs according to the tumor location. So I compare what difference between Western society and Taiwan. We can see in Taiwan, we have higher prevalence rate of UTUC. And the UTUC proportion, we can see the incidence of UTUC in Western society accounts for only 5 to 10% of all UCs. But in Taiwan, the incidence of UTUC markedly increased to 30% of the UCs in Taiwan. And also the ratio, the renal pelvis and the ureter ratio and the gender ratio are also present different from Western society. So that's why we are very interested in the spatial features of UTUC in Taiwan. So from these two figures, we not only observe the increased incidence of UTUC, but also the increased proportion of UTUC in oral UC. The left the two figures represent the incidence of bladder cancer and UTUC by years. The right figures reveal the proportion of UTUC and bladder UC in whole UC. As you see, UTUC increase more rapidly than the bladder cancer. Furthermore, more than 50% of UC in women were UTUC. These characters have never been observed in other countries, and we all wonder to know why and what happened to them. So in previous research, we have known that in Taiwan, there is a large proportion of Taiwanese had been exposed to aristolochic in the past decade. So from our database research, we found the aristolochic acid have higher impact in UTUC incidence. So since then, in 2003 year, our government have begin to prohibit the intake of aristolochic acid in Taiwan. However, as we see in the picture, even after AA prohibition, the UTUC incidence did not decrease rapidly. Also represent a high incidence. So we wonder if there is any other causes will impact the incidence of UTUC. So there are also another arsenic exposure caused the incidence of UTUC in Taiwan. And we can see the picture. The Blackfoot disease is the endemic areas is in the southern of Taiwan because the inhabitants in this area drink well water, and the well water have arsenic exposure pollution. So the inhabitant lives here may increase the incidence of UC and also other disease like skin cancer, and the renal function impairment. So since that this incident happened in decades ago, but now in this area we don't drink well water anymore now. So the incidence between the northern and the southern become more similar. So because the difference, we want to initiate a whole Taiwan collaboratively clinical study. Why UTUC registry is important? Because as we see previously, it presents spatial disease behavior in Taiwan, such as arsenic water, and we have higher incidence of ESRD, and the female have higher incidence than male. So we want to collect big data. Although it shows low-level evidence, but will have high external validity. The purpose of the registry is to identify high-risk patients and explore of new treatments such as immunotherapy or other target therapy for the candidate biomarker. And also we can develop our own Taiwan UTUC guideline. So it's our purpose to initiate the collaboration clinical study. So the first protocol is a retrospective study from southern to northern. The whole Taiwan will include 13 hospitals, and about 2 years collection, we have accumulated almost 2,000 cases. And also from our data, we can see the incidence also will show female have higher incidence than male. So in detail, we can see the difference of gender difference. Not only incidence cases or death cases, we can see female have higher prevalence and incidence than male. The difference have significant difference, and we can also see the age. The male have younger than female. It means maybe male will cause the UTUC younger. So talking about the operation methods, this in recent years in Taiwan, we prefer to use hand-assisted laparoscopic nephroureterectomy with bladder cup excision. Is the most usage technique. Yeah, from our database, we can see the trend, and also we can see the 2-year survival. We can see the overall survival, disease-free survival, and the cancer-specific survival. We can see the KM curve of these 3 survival were compared and it showed it's about the 80% survival. And next, we want to see the difference between different operation methods, and when comparison of radical access and endoscopic access, we can see if the patient receive radical mechanical nephroureterectomy access, it presents better disease-free survival. We can see the value is significant difference. And the next we compare the different stage of UTUC, and we can see the more advanced stage, it must be have a worse survival. Also in all our survival KM curve. And then we look back to our medical center research team. We also focus on UTUC research. We also have our own hospital clinical cohort. We have collected more than 10 years. And we also collect blood urine specimen in our tissue bank for further basic study. And we also collect bladder cancer and UTUC as well. And we have a comprehensive clinical cohort, and we also have some frozen tissues. Why we want to do some basic and clinical research? Because we want to find some new biomarkers. We want to refine risk stratification, and because now there are no reliable marker, we also have we can check some blood level to see to see the prognosis. So we want to find some important biomarker for early prevention and management. And the next, we also want to overcome some deficiency of conventional chemotherapy or new immunotherapy. So maybe we can find some new target therapy. So this is our one strategy to build up UTUC molecular database. And after data mining, we can confirm their significance from our basic research, from the transcript or protein level. And furthermore, we can use UC cell line for functional validation. And from this strategy, we also have some previous study about all these strategies. And also we use next NGS combined with bioinformatics. Also, the purpose is to find some candidate biomarker. This is our method. And the aim of our current study was to identify differential expressed genes between tumor part and the non-tumor part of a UTUC clinical specimen through deep sequencing and identify novel microRNAs potentially involved in UTUC through bioinformatics approach. So combined with our NGS data and my MIRMAP database, we can identify some candidate genes or potential gene we are interested in. So we further to search in GEO database. We also can find these genes have low expression in Hsiang carcinoma tissues. And we also do some basic in some UC or UTUC cell lines to see the messenger RNA expression of this gene. We also can see the significant difference. And from we also use our UTUC tissues and to see from 10 patients were evaluated for PDE5A expression through real-time PCR. We also can see the significant difference between tumor and normal tissues. And this paper is published this year. We also use our clinical database to see some significant prognostic factor will impact the cancer progression or to see how this impacts the future. So this two paper is for example, and hyponatremia or BMI, body mass index, have some impact of UTUC patients after radical nephroureterectomy. So there are still many unmet needs we need to overcome, such as the outcomes of radical surgery with or without lymph node dissection is an important issue, or the diagnostic ureteroscopy before radical, or how or the role of neoadjuvant or adjuvant chemotherapy, immunotherapy, radiotherapy. There are so many things we need to figure out. So it is the important thing we want to do more research about that. So the future mission, we also will keep collection of our clinical data and specimen for more detailed clinical and basic research. And thank you for your attention. That's my talk. Thank you.
Great. Okay, thank you very much, Professor Lee, for the nice introduction of TCC upper tract and the situation in Taiwan, which is definitely very different from the other parts of the world because of the high incidence and also the special epidemiology. If you don't mind, I would like to ask you some questions concerning this topic.
Yeah.
So, as there are more cases, I mean, it's more prevalent in Taiwan in terms of UTUC upper tract. Do you see any difference in clinical outcomes? I mean, after treatment, in the patients in Taiwan compared with other reported series in other countries?
You say the survival rate?
Yeah, in terms of survival or recurrence, and yeah.
Recurrence, I think not that difference. About the recurrence, not the difference between the Western society and the Taiwan about the survival or recurrence rate.
I see.
Similar. Yes.
I see. So as the incidence of UTC is quite high in Taiwan, as in the case, for example, in Japan, when there are a lot of people having stomach cancer, they do screening OGD, I mean the upper tract endoscopy of the stomach to look for, but this is not done elsewhere because the incidence is not that high. Do you think, I mean, is there any special screening program or do you do extra screening for patients in Taiwan or in your region that you can screen for the early cases?
Honestly, we also only have the cytology or the sign, or we can use the echo to see if if the patient have hydronephrosis or renal pelvis tumor. We don't have positive screening method to confirm UTUC earlier. We also similar screening method with Western society. But as we know, cytology have low sensitivity. So that's why we want to find more interest or potential biomarker also can use for screening.
I see. Do you think, what are the prospects, as you mentioned, do you think in the next 5 to 10 years, do you think there will be good prospects of having urine markers in screening for UTUC that can be applied to the patients?
Yes, I'm working on this.
Okay.
We also want to find some. Yeah, I will also want to find some special urine marker, and so we collect some urine sample. Maybe we can see some free cell-free DNA analysis. We will collaborate with Concord.
I see. Sure.
Yeah.
In terms of screening, which are the type of patients that you think will benefit most from screening for UTUC, like the age or the sex or whatever, like smoking? Do you think?
I think, yeah, because in Taiwan we also have higher incidence of renal function impairment. So,
Hmm.
as a previous research also see, the ESRD renal function impairment or ESRD patient have higher incidence of UTUC. So we also, of course, we can highlight some high risk factor patients. So, like you say, patient with smoking and patient with renal function impairment, like this. Maybe we can do some more research about these special high risk patients.
I
And
see.
also from our previous, yes, such as our previous research, the Chinese herb intake also will cause higher incidence of UTUC. So maybe we also need be careful or the patient who are taking Chinese herb.
I see. Um, Another question.
Yeah.
Uh,
Mm.
in your slides, you mentioned the survival and the recurrence of the UTUC patients with nephroureterectomy done is much better than those with endoscopic treatment or segmental
Yes,
resection.
yes,
So in that case,
yes.
would you recommend against doing endoscopic? You know, it's in some places it's quite popular doing the laser ablation
Yeah, yes,
in the
yeah.
ureter or in the kidney. Would you recommend against that?
I think I don't against the endoscope method because we need to be when we do endoscope surgery, we need more careful about the recurrence. And as previous
Hmm.
research, we can find a higher recurrence, or if we want to survey these patients who receive endoscopic laser ablation, we need to follow up these patients more shortly or more carefully. I think the problem is we need to, if we can take these patients more carefully and survey scope more intensely, maybe we can we also can improve the patient's survival. I mean because the strategy of follow up
Hmm.
must be very different from the patient who receive radical surgery. I think maybe we need to do more research about the follow-up strategy. If
I
we
see.
can, if we can improve the strategy, I think the survival will not very different.
Hmm. I see.
And
So it's
and
yeah.
also and also the endoscopic surgery, the technique is also very important. Technique
Hmm.
and the tool, the high power laser. If you have
Hmm.
the higher power laser, or you have a better technique for you can see the tumor more clearly. And also we
Hmm.
need to pick up suitable candidate to receive endoscope laser ablation. The suitable candidate is very important. Yeah.
I see. I completely get your idea that
Maybe the
you
patient,
yeah.
yeah.
I see. So
Maybe only one tumor. Yes. Yeah. Mm,
I see.
yeah.
So probably the case selection and how
Yeah.
closely they are being surveyed after the endoscopic treatment
Yes.
is actually of utmost importance in and then probably the worst survival might be related to you know poor selection
Yes.
or poor surveillance, which led to worse outcomes.
Yes.
I see. I
It
see.
is my point. Yeah.
I see. So
Mm,
okay. Yeah. Thank you very much, Professor Lee, for giving us a lot of insights into this topic.